Well, gentlemen, heading in for a health screening may not be at the top of your to-do list, but it should be. And now there's a clinic who is making it so easy that there are no more excuses.
We're talking about making it free, and you don't even have to make an appointment. Mike and Meredith Whitfield are here to tell us more, and we have a gentleman here that's going to, go to the horse's mouth kind of a thing. You're going to tell us. And, I really do think that men's health has kind of been everywhere. I feel like everywhere you turn, whether it's magazines, TV, it's kind of taken a forefront. Why do you think that is?
So what's happening right now is this trend in testosterone. We say all the time that this is the best thing and the worst thing that's ever happened to men's health. So lately you see a run of ads that say, hey, are you feeling tired? Are you picking up some weight around the midsection? Maybe you see a lot of ads about sexual dysfunction or guys not being able to perform like they used to. And a lot of that is all attributed to, you must have low testosterone. The danger in that is that low testosterone's symptoms mirror the symptoms of dozens and dozens of other health conditions that if they go unchecked or untreated, they can really harm or hurt a man to put him on testosterone. So these, what we call affectionately shot boxes, have kind of popped up all over the United States, targeting men to sell a testosterone product. The good news is that it's pulled men out of the woodwork to get screened for something where guys are typically really horrible about that. But the bad news is they end up at the wrong place. They can get really bad advice and really bad health care, because the point of a lot of these places is not to give good health care, it's to give a product. And that's where Epoch comes in and where we kind of make a big difference.
So then, Meredith, how did your family kind of get involved in men's health and therapies, such as, the testosterone treatments?
Well, Mike was a really young husband, and we had 3 children at the time, and he would come home from work and he was tired or he was exhausted. He didn't really have the drive in life anymore. He was working out, but not really getting the results that he wanted from the gym. And so as an RN, I just began to realize that something was wrong. And he has a medical history of a lot of different cancers and things in his family, and he began to pick up an enormous amount of weight. So I just kind of pushed him towards, hey, let's just go get this checked out. Find out if there really is something wrong, and if not, great. So he went to the doctor, and several tests later, they came back and they said, well, your husband's perfectly healthy, except that he has low testosterone. And I was completely floored, because I didn't think of that as something my young husband would have. You think of that as an older, aging issue. So once he began to get treatment, the results were fabulous, and we enjoyed getting our dad back and my best friend back and my husband back. But at the same time, it was a concern because, okay, great, I love the benefits of this, but what is this doing to you, long term? Who's really following this? And so he really got into researching, all right, let's make this safe, because I love the way it makes our family feel. It really changed and revolutionized the way our family functioned at home.
Well, Meredith, let's be honest. It's usually the wife that does the little nudging to get the hubby to go in for a screening. So, Mike, what, besides Meredith, made you turn from like a reluctant patient to now you're wanting to be kind of at the forefront and help other men?
So once I got on this therapy, and yes, I represent kind of the cliche male. Even with family history, I still wouldn't go in. And that's a lot of our younger demographic. Then you get into an older demographic who's set in their ways. And a lot of guys don't go in until something's really, really wrong. And you feel it, and by the time you feel it, it's too late. So she got me in, and I started working with one of these shop boxes because that's where I ended up finding myself to get treatment, because it was really hard to find at the time a place that would give me this medication as a younger guy. And all these side effects started happening, and there was no one properly monitoring me or watching me. So I was really close to a team of urologists through some other work engagements. And we started kind of evolving this model where we thought, I have kind of a marketing expertise, you guys have the medical expertise, let's band together and kind of unify urology. Urologists kind of inherit all of men's health because they handle everything, that a guy has a problem with. We don't have a man doctor. And so urologists around the country have real problems with these shot stores because they don't truly follow the care. So I got very passionate about making sure that I could help the docs in the community to really key in on what a guy needs and to provide the testing and that free screening we talked about. That evolved out of basically 3 things: to go into the community and educate the men, teach, then to go in the community and test the men, and then to treat them correctly. So we developed this $1,600 test that allows men to go in with no appointment, no cost, no anything. It takes 15 minutes of their time, and they get an evaluation head to toe. So if they're already going to a shop box and they want to make sure that they're getting the proper treatment, that's what Epoch is for. If they've always wanted to go, but they're not sure what to do, or it feels a little, I don't know, it doesn't sound right, you can go where real doctors own it. 3 different urology practices in Tucson joined together to bring this here, to provide the service and to combat that locally. And that's kind of what Epoch's all about.
Absolutely. Now, before we let you both go, Meredith, you're obviously a lovely wife, a loving mother. You've been through this before. Any of our viewers that are currently watching might be thinking, you know, this sounds like my husband. My husband has these symptoms. You know, what is some advice that you might give them?
Yes, well, it's definitely difficult, and women just have to stay in there and fight the good fight. Men are great about supporting our issues, but it's really time that we step in there as the major healthcare decision maker of our family. And if that means dragging your husband down to a clinic, these clinics are designed for men. They're really good looking. They're, you know, you've got coffee bars and Wi-Fi. You can do your work there. It's quick. It's in and out. Ladies, if you have a husband, a father, a brother, an uncle, just anybody in your life that's really lost their energy or their desire, you've got to drag them down there. Literally grab them and just take them down there. Trick them with something. I don't know. But get them there, because it's a free screen, and every man should want to do this for their family, for the livelihood of their family. It will really make a difference in their lives just as much as it's made a difference in our family. And our 5 children are beautiful and happy that they have an active dad back in their life.
So, you know, we're going to the football game, but, you know, we're really going to go here. Mike, really quick before we run out of time, where is it that we can get these screenings?
So, Grant and Swan, right at our Epoch Health location. You can go to epochmenshealth.com to get more information. A lot of guys need treatment. They just need it correctly. They need it safely. So go where the doctors are, go where the facts are, and get the right thing to take care of yourself.
Safe treatments, exactly what you were providing. So again, we're going to make sure that all of our viewers have the information, and I want to thank you too for joining us this morning.
Thank you.
Thank you.
And again, you're invited to the Epoch Health Grand Opening Celebration tomorrow at 4951 East Grant Road from 5:30 to 7 p.m. with the ribbon cutting at 6. For more information, call 448-0401 or go online to epochmenshealth.com.